Welcome to this introduction on reconciliation in child welfare. We're going to be talking about the Touchstones of Hope for Indigenous children, youth, and families. The goal of this session is to provide you with background information about the Touchstones of Hope in child welfare, what this process looks like, impacts it could have on your community, or perhaps you're an organization working with Indigenous peoples and you want to know how this process could be incorporated or the principles could be incorporated into your work, and how this could be used in other contexts outside of child welfare. What you're seeing here is a cover letter for a warrant dated 1895, drafted by the Department of Justice for Duncan Campbell Scott, who was then acting Deputy Superintendent General of Indian Affairs, which is now known as Aboriginal Affairs and Development Canada. It is the earliest known example of child welfare intervention in that it allows for the removal of First Nations children and their placement in residential schools for education because it was believed that they were not properly cared for. The latter provision is very similar to today's definition of neglect. As the Royal Commission on Aboriginal Peoples have stated, residential schools were a very popular child welfare placement. Social workers often served on residential school committees, and in 1948, the Canadian Association of Social Workers made a submission to a joint House-Senate committee supporting assimilation, as well as calling for the expansion of provincial child welfare on reserve. By 1967, George Caldwell, he was a researcher, he did a study and found that 80% of children placed in Saskatchewan residential schools were placed there for child welfare reasons. Despite the many public reports of maltreatment at the schools dating back as early as 1907, there are no known reports that child protection authorities ever investigated the complaints. As you can see, First Nations children are dramatically overrepresented at every stage of child welfare intervention, ranging from reports to placement in child welfare care. While physical and sexual abuse do occur in First Nations communities and must be addressed, the overrepresentation is due to neglect fueled by poverty, poor housing, and caregiver substance misuse related to the colonial effects of residential schools. The Canadian Incident Study on Child Abuse and Neglect finds that First Nations children are 12 times more likely to be removed under court order than other children. Across Canada, the overrepresentation rates are dramatic and increasing. As Cindy Blackstock has stated, there are more First Nations children in child welfare care today than at the height of residential schools. This slide actually shows the cumulative number of nights that First Nations children on reserve and in the Yukon have spent in care between 1989 and 2012. This excludes 2011 data for Ontario. And what we see is that although this has been provided through government documents, these numbers, this could be an underestimate of the numbers nights in care that First Nations children have spent. And many times when we look at numbers like this, a lot of times we forget to ask, well, what were those children thinking? And a lot of times they might be thinking, well, when is the next time I'm going to be seeing my mom or dad? When is the next time that I'm going to go back home to my community? And although the statistic refers to First Nations children specifically, researchers have indicated that the same is true for Métis and Inuit children as well. And we also see that it could be true for Indigenous children from other countries, especially countries that have also had similar histories to Canada with its Indigenous settler relations, including countries like the United States and Australia. So one of the things that we look at when we look at a Touchstones of Hope movement specifically is Indigenous worldview and child welfare. One of the big questions we ask is, do Indigenous children need care that is rooted in culture and community, or do we simply want to move deck chairs on the Titanic of the current child welfare system? Because most of you who are listening to this session realized that there is something that needs to be done because perhaps the current child welfare practices are not working for your community or organization. This now brings us to the history of the Touchstones reconciliation movement. In 2005, people from Australia, the United States, and Canada got together to say and question, why do we have this overrepresentation of Indigenous kids in child welfare? Why are not more children, why are they not being left in their communities with their families? So this gathering was prompted by the growing awareness that there was becoming a crisis within Indigenous child welfare, and that Indigenous children were not having those opportunities to grow up in their communities or in their homes. So the people who attended this gathering had open talks on the history of child welfare from both the Indigenous and non-Indigenous perspectives. Their discussion formed a foundation for the development of community-based action plans. The values identified were necessary to build a foundation for an improved child welfare system. And one of the things that participants thought was, it's fine to have these Touchstones principles as values, but we need something more than that. Reconciliation is absolutely needed to move forward in child welfare. The participants in Niagara Falls had these conversations, and this is what resulted. As you can see, this is the process of reconciliation that appears. And it is true that reconciliation is something that is not going to happen overnight, and it's something that is not perhaps linear. But often in many reconciliation processes, the first step becomes truth-telling. And in this case, the people in Niagara Falls who came up with these principles and had these open discussions talked about reconciliation in the sense that truth-telling included telling the story of child welfare from both an Indigenous and non-Indigenous perspective, and how it has affected Indigenous children, youth, and families. They also talked about acknowledging, so learning from the past, seeing one another with new understanding, and recognizing the need to move forward on a new path. And that's one of the things we talk about in the Touchstones of Hope movement, is readiness. This also relates back to acknowledging that people need to be ready to acknowledge that something needs to be done, and have the courage or have, the readiness in their own organization or in their own selves to move forward with something like a Touchstones process. Next, we come upon restoring. So this includes doing what we can to redress the harm and making changes to ensure it does not happen again. The last thing is relating, so working respectfully together to design, implement, and monitor the new child welfare system. And this new child welfare system is often based on the interpretation of the Touchstones of Hope principles within the unique context of each community that Touchstones is in. So when you see a process happen in, say, for example, British Columbia, it's going to look completely different than anywhere else in the country because there's different customs and traditions, say, for example, for the Haida Nation, as opposed to Ojibwe or Cree nations, or the Mi'kmaq on the East Coast. So when we looked at the Touchstones of Hope process, we also see that there are these guiding principles to guide that process. And this is really where, in a Touchstones of Hope process, you have these principles that are defined within the unique context of different communities. So we have, first of all, self-determination. So when we talk about self-determination, it means that Aboriginal communities, Indigenous communities, are in the best position to decide what is best for their communities and for their children. Holistic approach refers to looking at things as a whole. So as opposed to looking at things in a singular way, we look at children and communities as a whole. So a child, for example, it's not just about child welfare, it's about education, it's about health, it's about ensuring, um, kids have community values and culture, their language, all of those things that make for healthy children. Next is culture and language. So looking at and recognizing the importance that culture and language play on a child's development, and why that's important for children in their communities. And for example, looking in social work, do the policies and practices respect the values of different communities? When we look at structural interventions, we look at those really key issues that have already been mentioned earlier in the presentation of why First Nations kids and Indigenous children are removed in the first place from their homes. And often there are reasons like poverty, poor housing, and caregiver substance misuse. So often these end up resulting in neglect of children in the homes. And so this is when we look at interventions that prevent those things from happening. The fifth touchstone is the non-discrimination touchstone. When we look at that touchstone, we look at that Indigenous children should not be treated inferiorly because of who they are or where they live. Also looking at policies and practices, do those policies and practices reflect non-discrimination in all aspects? A lot of people ask, well, how is the Touchstones of Hope different? Because many times, I'm sure we've all been to those presentations and to those events where really good ideas happen, but nothing results from anything, and it just remains, a really good networking experience and 2 days of presentations and really good knowledge sharing. But this is how Touchstones is different, because it's not just an event. So when we look at Touchstones, we tell people this is something that requires a little bit of investment, because it really looks at how to make sustainable change in child welfare versus just having an event where people are trained in something but nothing happens after. Another reason that this is different is that the principles are defined and interpreted by community and informed by evidence. One of the things that is really good about this is that it really underlines the principles of reconciliation, that everyone can make a difference. And so in Touchstones movements, you have both Indigenous people participating as well as non-Indigenous people, but the Indigenous people take the leadership role. Also, it allows new concepts of child welfare to emerge. The Touchstones of Hope, as I had stated, is not just an event, but it's rather a movement. So often what will happen is communities will say, I want to explore the Touchstones of Hope principles and the process. Where do I start? So many times the best way to start in the Touchstones movement is to start with a regional session. Then what would happen is an advisory committee would be formed. And what the advisory committee do are they are the keepers of the movement, you could say. They're the ones who ensure that work gets done and that events do get planned within the movement, and that there is the momentum that keeps continuing. The advisory committee, they're also the ones who are in charge of bringing information back to communities. So on an advisory committee, for example, if you had 60% Indigenous people and 40% non-Indigenous representatives, then that 60% and those 40% would be in charge of reporting back to their community or organization about the movement and what kinds of things have been decided within that committee. Another step that many communities have taken is to have a train the trainers. So with Touchstones of Hope movements, the goal is for the Caring Society to take a guidance role and do some training with communities if that's what they choose, and to have people, train networks of facilitators in different either communities, regions, or provinces, or even organizations, so that those trainers can train other people on how and brainstorm and vision plan with them about what it would take to have a healthy community and healthy children in that community. This is when, once we have the trained network of facilitators, we go on to the community sessions. Community sessions is really where the amazing things happen, because people at this point are usually pretty excited and have probably heard about the Touchstones of Hope, perhaps from those advisory committee members or from the regional session. Community sessions are really the place and space where people are able to come as themselves and talk openly about how child welfare has affected them in their community. And from the community sessions, those groups end up having next steps that they come out of that session with. And that's when we go to community implementation. So the next steps are really what inform community implementation of Touchstones of Hope. In the middle, you'll see that there's information and engagement workshops. The Caring Society has done some information sessions as well as engagement workshops with organizations who have wanted to find ways to work more respectfully or in ways that engage the Indigenous community more. The Caring Society created a Touchstones of Hope toolkit, which describes all of the parts, all of the movements of the Touchstones of Hope process and how people could go about starting a movement. Part 1 really talks about the regional sessions and what it would take to begin the reconciliation journey. So as I had mentioned, there's a regional session. So it's really just an information session with leaders from the community, elders, youth, child and family service agencies. Essentially what happens is 2 days of discussions aimed at simulating the community-based sessions to develop a culturally specific vision of healthy children, as well as the next steps of how that could happen. It allows participants to make informed and self-determined decisions regarding future participation of their community. So it's not something the Caring Society says you have to do this. It's really something that communities are able to say, well, this is interesting and I would like to try this. For the regional sessions and the community sessions, the Caring Society has often used this tool. It's called Path, Planning Alternative Tomorrows with Hope, and it's a tool from Inclusion Press. This is a really interesting tool that helps people form a dream of what it takes for healthy Indigenous families and children in a specific community. So the 2-day session for the regional session and for beginning the reconciliation journey would start with this tool where people would gather. So for example, say if you had a group of 50 people, it would be a balance of learning about each of the touchstones. So learning about what structural interventions is, learning about non-discrimination, learning about all those touchstones, but also having the opportunity to create this dream vision of what healthy children and families are in the community. So you would start with a dream, and the dream would include, we've seen things like, all children know their language. So say, for example, and then you would brainstorm, all participants would have the opportunity to contribute. Ideally, with that group of 50, you would split, you would have several facilitators for small groups who would help each of those small groups come up with their own dream. And they would be shared with the larger group at the end. And so in those small groups, you'd create your big dream of what it is to have healthy Indigenous children and families in the community. And then what you would do is go on to the indicators of the dream. How do you know those things are happening? The dream only has two rules. It needs to be possible and within about 5 years, and it needs to be positive. And this really sets a really good tone for this activity because people want to continue on and they want to form their dream and get to the next steps. So indicators of the dream, if for example you had all children know their language, indicators might show that there's actually schools there's more schools in the communities if there are none, or perhaps more children are speaking the language in the community. Now, how do you know what things are happening or not happening now? And then you would also brainstorm resources. So who, what, and how do you make it sustainable? And then you get to your next steps, which are very concrete. By the end of the activity, sometimes people in the group say, oh, well, this is what we've been doing in our community. And they end up connecting with someone else who's been doing something else in a community. So it's really, really a good activity for something that you would want to start. The second part of the toolkit looks at, it's the traveling the river piece, and it really provides the building blocks for hosting community vision sessions. So when we look at, I talked about the trainer sessions, so it goes through facilitation skills, looks at the Touchstones of Hope model and explains it. It provides research on First Nations children and families, and it also has participant support plans for community sessions. And at the Caring Society, we are always welcome to provide ongoing trainer support. So you can also access resources on our website. You can go on our Facebook feed or our Twitter page at Caring Society. But we're really open to providing support needed for trainers. So feel free to contact us if you are a trainer listening to this workshop or you're interested in becoming a trainer and want more information. Part 3 really looks at the community visioning sessions. So this is the piece where we really stress to people that we want people to come into these sessions with their titles left at the door. Because we want people to participate as individuals, not so much as who they are in their jobs or as a job title. And this is important because it sets the stage for reconciliation, and it sets a good tone for people coming in and actually telling the truth about child welfare and how it has affected them. So we want to create spaces that are very respectful, and so people do feel comfortable in those sessions. And oftentimes the advisory committee are the ones who end up planning these sessions, and they are the ones who end up knowing the different groups of people in the small groups. So it functions kind of like a regional session where you have a large group of people listening to presentations about the Touchstones of Hope, and often in the community sessions, these sessions are done by people from the community. So for example, if you're learning about culture and language, a good person to invite might be an elder who could speak to perhaps their experience at residential school, but having, perhaps their story of how they were able to, how it's affected them, or how they were able to overcome the things they've gone through. Perhaps it's an elder who wants to share cultural teachings. It could really be anything, but we like to have community members present on these different touchstones because it is meaningful. And so with that said, the participants come as themselves, and the advisory committee are the ones who say, well, maybe, they form the small groups, and they can actually form them based on if they know there are certain specific conflicts between individuals, they could maybe separate them. If there's maybe a supervisor in one group and maybe a staff member it might not be a good idea to put a staff member with them. Really, we just want to create the most comfortable space possible and respectful place. And so essentially, it's, again, a 2-day session in the community attended by 60% Indigenous and 40% non-Indigenous leaders. When we talk about leaders, we talk about those people who are child and youth champions by lifestyle, not employment position. So, for example, I've seen a lot of instances where there's been really strong social workers or really strong people who are already doing really amazing work, and they're already natural leaders. And those are often people that are invited to Touchstone sessions. Also, it's a very good idea to have elders at these sessions. If you separated your group into small groups, there should be an elder there. So for each small group. If you just decide to keep a larger group, then there should be a few elders just to provide support, especially, because we are talking about kids, and we're talking about removals of kids from homes, and often it has personally touched the lives of a lot of people working in this field because it's child welfare, it's social work. It can be really personal. And so it's really, really good to have culturally appropriate supports for all participants and celebrations. The Touchstones of Hope Toolkit, Part 4, looks at the Caring Society's previous experiences with the Touchstones of Hope. It provides a research toolkit to conduct participatory action research documenting the Touchstones of Hope process. It provides a University of Toronto evaluation of the Touchstones implementation in Northern British Columbia. It has sample vision implementation work plans. So when we talked about in the PATH activity how we had next steps, it provides a chart that shows you what to do with the next steps after. And it also has additional resources because oftentimes we see that there are structural interventions for things like poverty and poor housing, caregiver substance misuse. So we've put some promising practices and resources in the toolkit so that you have some tools in case you are looking for, things that can be done for those specific interventions. I had talked about in the previous slide, the Caring Society worked in Northern British Columbia from 2008 until about 2012 on a Touchstones of Hope movement with 5 Northern British Columbia communities. It was actually the agencies, so it was more communities, but 5 agencies that serviced many communities in Northern British Columbia. We documented this process and participated in participatory action research. The findings are in this evaluation report. Dr. Michael Saini from the University of Toronto helped us come up with a format of how we could engage in participatory action research to actually document the results of this process. What he came up with was that participatory action research has been used in communities where all of those involved in the process become active participants and active researchers. So what this meant for us was that as facilitators, we recorded all of our community sessions. There were 5 in total. We recorded every single small group discussion and the large plenary sessions. Once we submitted our recordings, Dr. Saini uploaded all of those findings into a software program for qualitative data analysis. So himself, along with Ashley Quinn, a PhD candidate, analyzed those results, and those results were put in this report. So some of the themes included, when we looked at self-determination, you have things like decision-making, family, government, Indigenous knowledge, ownership, prevention, all of these types of things that you would find in the self-determination themes. And I have to say that although these themes are British Columbia specific, they appear in other sessions as well. The Caring Society has been engaged a little bit in a a process in Saskatchewan, and you do find these common themes across the board. You have the non-discrimination touchstone. The themes that came out of that were things like funding, historical. You have references to Jordan's principle. Again, you see that overrepresentation. You have the structural intervention themes, looking at things like addictions. People had a lot of experiences in the community seeing things like drugs, a need for more employment and economic opportunities, having healthy children, having more housing, and not having overcrowding. And you see all of these themes that relate to the structural interventions touchstones. Then you went into the holistic approach themes, so looking at a lot of times people had talked about elders were always mentioned, looking at the chiefs, youth, all of those people to help communities, looking at culture. And then when we went into the culture and language themes, the report found a lot of words like identity, language removed, looking at teachers, different clans. So really a lot of the themes intersect, and that's really one of the unique things about the Touchstones of Hope is that they don't work separately. A lot of them work together and are related. When we looked at some of the lessons learned from the Touchstones of Hope movements that we've been engaged in and from people we've talked with, readiness is one of the biggest predictors of success, because we feel that sometimes people are not ready to undertake something like this, either stating that, you know, things are fine the way they are, or or having, you know, also feelings of hopelessness. Well, how is anything ever going to change? But really, others have been really ready for processes like this. Like in Saskatchewan, for example, British Columbia, there are places in the United States that have undertaken Touchstones processes, also other countries, as well as the United States, like Australia. So readiness is one of the key things that people need to keep in mind. If people are not ready, we just say, you know, the door is always open for you to join us at a later time. There is a need for dedicated support people to guide the process through to implementation. In the Northern BC Touchstones process, there was a Touchstones of Hope coordinator for Northern British Columbia, and that was really successful because that person had a very good relationship with the agencies that we were working with, as well as community members. That person was very well connected and was able to help with the implementation. This is why also the advisory committee is so important, because it's really about having that support system in place so that people are accountable to, you know, if things have not been getting done, for example, with the next steps piece and implementing in the communities, why hasn't that happened? Really just having a good support network. Evaluation is also very important because it helps document. And also if you're an organization or a community that applies for funding, because there is no funding to do these types of sessions, then it's really important to show evaluation, because a lot of times the evaluation shows good things. We've seen really, really positive things through the Northern British Columbia Touchstones of Hope evaluation through the University of Toronto. So it is important to include that piece. Adapting resources is always ongoing, so we try to keep our Touchstones of Hope resources current, and we update things on the Touchstones of Hope website frequently, so please always check back on the Touchstone site for more information. Non-Indigenous people often need the most support in the process, but support for everyone is important. It is important to have those support people at any gatherings you have, it makes the process a lot easier, and it just feels more supportive being in those sessions and knowing that there are people supporting you no matter what you're going through at those sessions. Because what we have also learned is that reconciliation does involve courageous conversations. And I don't think it's something that anyone needs to be afraid of. But again, this is what readiness comes in, is that sometimes people are not ready to have difficult conversations. And that's quite okay, because it's all about people growing at their own pace. And especially to not just as individuals, but as organizations and communities. As I was saying in the beginning, we wanted to give you just a brief overview of how the Touchstones of Hope could be used in other contexts. So the reconciliation framework has been used for universities, labor unions, as well as governments. So it's something that they recently we worked with a labor union who wanted to see how the Touchstones of Hope principles could inform people within the union. Not just about Indigenous people, but also about themselves. So, how these principles could apply to them in their own work and working with Indigenous peoples. So it's used also to inform self-determination visions for communities across disciplines and times. So it's really about looking at Touchstones of Hope as something that is more universal than just for child welfare, because it could have applications in education as well as things like health. We know that the many hands, one dream principles are very similar to the Touchstones of Hope. They weren't based on the Touchstones, but they were created in a similar fashion, and they ended up becoming quite similar. So it's just to say that the Touchstones of Hope principles can be universal and used across many disciplines. The First Nations Child and Family Caring Society has the First Peoples Child and Family Review. This edition here was authored and peer-reviewed by children and young people who had something to say about reconciliation. What was really special about this edition is that we used our process of reconciliation in this edition, and children and youth really ended up writing about all of the process, so truth-telling, acknowledging, restoring, and relating. You can see this version on the website that's listed below, and you can also find an order form if you're interested in purchasing a print copy. This here is children at the annual Have a Heart Day here in Ottawa in front of the Parliament buildings on Parliament Hill. And really, when we look at the Touchstones of Hope, we look at reconciliation. So this is really powerful in that it shows the Touchstones in action as a social movement. So again, going back to the Touchstones of Hope as an event, it's not just an event, it's more than that. It's really about reconciliation and ensuring that Indigenous children and all children receive the same things and have the same opportunities to grow up in their homes, to be safe and comfy in their schools, and really to honor their cultures and languages, because it's always so important. This brings us to the end of our Touchstones of Hope session. But if you have any questions, please do not hesitate to contact me. My name is Andrea Auger, and I am in charge of looking at our Touchstones of Hope. So there is my email and the contact information. So thank you very much for listening, and I hope you have a wonderful day.